Navigating the Medication Administration Record, or the MAR. When attempting the implementation station, you should already be familiar with the MAR, so you can navigate it quickly. You should note that the format of the MAR may not always be the format you are most familiar with using, but it should still contain all of the key information that you need. On each page should be the addressograph of the patient, and when performing the station, you should ensure the addressograph on every page matches the patient you have in front of you. The first page of the MAR chart will tell you if the patient has any allergies, and if so, what the reaction of the allergy is. If, as part of your discussion with the patient, you identify a new allergy that hasn't already been documented, you should document this and sign it. You will also need to verbalize that you will get the patient a new allergy band. The MAR form identifies the correct codes to use if you decide not to prescribe a drug. The most common reasons a drug may not be given in the OSCE and need to be coded are Code number 9, low pulse and/or low blood pressure, for example, when administering hypertensives. Code number 10, other, for example, if the patient is allergic to the drug. And code number 6, prescription incorrect or unclear, for example, if the prescription is not signed. It would be very unusual for your patient to be nil by mouth at the implementation station, given they are testing your medication administration skills. The MAR will usually document the height and weight of the patient. Their weight is particularly relevant when prescribing, as it may affect the dose you give the patient. For example, patients under 50 kilograms should not be prescribed a full dose of paracetamol. As you progress through the MAR, you should find the prescription chart for the patient. Once only and stat doses are those drugs that should only be prescribed as soon as possible. The record should document the date and time that the stat dose is due to be given, as well as the correct dose, route of administration, and be signed by the prescriber. Prescribed oxygen therapy that the patient is on should also be documented on the MAR. If your patient is on oxygen in your OSCE scenario, you should check that the oxygen flow, for example 2 liters per minute, matches the flow rate specified on the MAR, and note whether the oxygen needs to be replaced or terminated. If target oxygen saturation has been reached, for example 96%, it is advisable to leave the mask on, but verbalize that you will discuss weaning the patient off the oxygen with the doctor after you have completed the station. Antimicrobial medications are also documented on the MAR. These are drugs that kill microorganisms or stop their growth. They are often antibiotics used after surgery or to tackle an infection. If the patient is allergic to penicillin, you should be careful they are not prescribed an antimicrobial from the penicillin family in this part of the MAR chart. If the patient is on any regular medications, these will be documented under the regular medications of the MAR. These tend to be antihypertensives, anti-diabetic medications, or bronchodilators. PRN are as required medications. This is medication that is not to be taken regularly and are usually prescribed for short-term or intermittent problems, such as medicines for acute pain, constipation, or behavior. It would not be unusual for you to need to prescribe a PRN as part of your OSCE implementation scenario. This is commonly a drug such as paracetamol or cocodamol. If the patient is receiving any IV fluid, This will be documented on the last page of the MAR. In the OSCE, if your patient is on IV, then you should check that the batch number on the bag is the same as the batch number written in the MAR chart. Check the expiry date on the IV bag to ensure it is not out of date and ensure it's running at the correct rate. Remember that whatever fluid infusion the patient has received by IV should be recorded on the patient's fluid chart, so this should be verbalized if applicable. Ensure you pay attention to the drugs not administered part of the MAR. If, for any reason, you decide not to give a patient a medication that they are due, this should be recorded in this section of the chart. It's very important so that the next nurse is also aware of your clinical decision. If you do not do this, it is a critical fail. Remember, if you decide not to give a medication because it isn't due yet, this does not need to be recorded as withheld, as it is not withheld. Now is just not the right time. Whenever dispensing medication, you should sign the MAR and time it to show the next nurse who looks at the chart what medication the patient has received. This is a legal obligation as a nurse.